and all over the world. Una good morning, good afternoon or good evening. With me today, I get one big alejo per nursing and midwifery business wey dey na Magbo Kanaya for 5 days training, but e don Kanaya from the 16th of this month, and we go want for know wetin e dey all about dey for these past days. So famble dem, una lis ten wey dey introduce himself and e go tell we small thing.
Good morning. Me na Sister Cecilia. Me na midwife educator at School of Midwifery Makeni. For the past 5 days, we dey Magbo and we dey train with midwives them all within the northern region, from Cambia, Putloko, Bombali, Kaine, and Magbo itself, on maternal and child health, specifically on how to prevent maternal death. As we all know, when the woman born, bleeding is one of the leading cause of maternal death. So one for train with midwives them all over, especially the one in a PhD. How they go able to identify woman where go get bleeding, how they go able to manage and refer them, so that we will save them mamaya and then pick their life. So for these past 5 days, we actually don't continue for train with midwives them on how them for provide care for women them, for prevent them for bleed, and also for manage them when they begin bleed during labor, so that we will save their life and they begin their life.
So that they're able to save the life of the mama them and the pikin their life. And then one key thing where then they all about for teach na the midwifery school. And as you say this time around, as see teachers themselves come from the midwifery school, what do you feel say this mean for the School of Midwifery Makeni?
And for the School of Midwifery, as a major objective now for train, so we can be delighted for join any team we come. This team come out now, USA and other partners then, for can train with nurses then and midwives then. So the school be delighted for join the team, for train with midwives then using the national protocol, knowing the fact that we know the issues of mama them and then picking them. So we can join the force from USA for train with midwives them on how for manage with women them where they come in labor for prevent maternal death, especially the woman that will go bleed during labor.
Especially the one that will go bleed during labor. So with all these 5 days, it's very, very hectic, because you say exam be day, practical day, then they write, then they take practical, then they write, then they take practical. So with all of this, what if you say that the most interesting one for you, because amidst all, I see where you teach, where you demonstrate, you so get passion, what you really be so passionate about, and where you really see say in this the participant themselves don't take after you, so that when they self go, they go really put her in practice, even if then they say where some things they're not available, we are in and go try for improvise.
Thank you very much. That one day we see, we know nursing and midwifery is all about practice. So as much as then they write, then they take tests, the hands-on practice now be really critical about this training. Because when we train them in theory, if they're not able for practice or see them as in real terms, it will be difficult then for them for practice in real patient. So the practical aspect of this training, I make the training very interesting and very important for midwives then. Like we say, we want for me to be able to identify women will for bleed during labor, how they will able to prevent that bleed, how they will able to manage the woman will begin bleeding in labor. So a lot of practical procedure they will do for me to able to see how they will look at the woman, the signs they will them for look for by the woman will begin bleed, how they will able to manage that woman the way they bleed, and how they will able to call other facilities there for help and move the woman to the facility where they always take for let them manage that woman there. So the practical aspect of this training now is really interesting, and I think that the participants they appreciate the fact that they're able to see them like in real case. So when they go back, they face with such kind of challenge, then we're able to put their hands together and save the woman their life.
So what in this mean for the rising trainers? Because he said the last training now be the eastern part of Sierra Leone, and they then be identify some of the participants there. We don't be rising trainers this year. So what do you think say it mean for them, and how them performance be there? And from these present participants them, when are they able to identify new rising trainers them for subsequent trainings there where they come?
Yes, indeed. Like we say, with the build capacity of we staff there. From the eastern part, we identify people where they get potential for become trainers. And we use this time also for building capacity in confidence and in competence for able to train others, not only within their facility, but outside of their facility as well, or out of their region. So for this training, we mentor them and pair them up with seasoned trainers or national trainers for be mentored and be evaluated. And that is what we don't do for the past 5 days. And we don't realize some of them don't build so much capacity, they don't develop the competence where they need as trainers. So this time we will give them certificate as trainers. Others will still continue for mentor them for the subsequent years ahead, so that they will build confidence for able to train others within the district and outside of the district as well. And for this cohort, we don't also identify few of them who will continue for mentor. So in subsequent training, we will use them also as rising trainers for train others. So in this way, we'll be able to build the capacity of the workforce, so that the more we get the rising trainers, they will also be mentors to the junior colleagues and to colleagues within the facility and outside of the facility, so that we're able to improve the quality of care where we midwives and we give to woman them and then begin them when they come to in a facility.
Thank you very much. So finally, you go able for send message to the upcoming midwives them, the one they when I will be, where they think for going to midwifery schools, or the one they way already did now, for let them give them best, and how you go motivate them more and more. And also you don't they do them, but in as much as you know, they now all the midwifery schools them, we get the School of Midwifery Kenema, we get the School of Midwifery Bo, and we same way so we get the one at Freedom, and the one where you did na Makeni, waiting na the message where you go send to them by how them go be very, very committed, serious, go for them practicals for them postings, so that then go be them midwives them, what will they point out tomorrow for be competent, and also for teach the novice them for let them able for work na the different communities then as alone the underserved communities, same way so na the urban setting.
Thank you very much. I think for we young girls that we also want for choose a career, I want to encourage you say midwifery are the best part for take, because you not only they deal with one person, you they deal with the woman in family and the community. For we already don't be midwives, I will encourage you for building on your competence, your skills, because then we might depend on we. We are not just providing care as conducting delivery. We also be dependent upon as the advocate for that woman there, the counselor, the teachers them. So you being a midwife, you for develop the skills, for reach out to them with women there, especially with young girls them, so that they're able to access the facility for family planning, for sexual reproductive health services generally. And for all the midwives and from the different midwifery schools, I want to say you have chosen the right path and not stop just by conducting delivery. You also need for no say, you get a role for play for build and empower the woman them within the community. Thank you very much.
Thank you very much. This na Sister Cecilia Masakoy, where they na the School of Midwifery Makeni, and in one of the trainer them, we don't come for equip the midwife them. Thank you very, very much.
Thank you.
So fumble them again as you they follow, continue for join me, Gifty Masakoy, with this program at the live na Magboroka town, and specifically at the Magboroka Government Hospital. As you don't hear waiting, Cecilia don't explain about this midwifery program. Same way so one key thing be there inside this program where we be talk about when I respectful maternal care, and for sake of that, then be pick one key person where don't they inside this particular program here for so long. He go introduce himself, the organization where they work with, and then he go take you through respectful maternal care, because women and they go hospital, young girls and they go hospital, they need support, they need help, they need for walking, and we need for respect them, whether they're disabled or however they present themselves, we need for give them respectful maternal care. Over to you. Say,
Thank you so much for giving me the opportunity. Famule unado mina Cinderella, me the work na Masanga, we na Kapakia, I the work as a clinical mentor and research assistant. So since Monday we don't start this maternal and child health training. We na conference training what we do. We train the midwives then. And the area of respectful maternal care, what we say, we not just want for look at the most them providing the care to the woman then the way they want. We want this care for let it be respectful. So as the word implies, respectful maternal care, now the care where every woman, according to the human rights, every woman get rights for get a safe care, a dignity one, and also a quality care. every woman get rights for get equality and safe and dignity, for save that woman a life and also the pikin. So if you, the midwife or every nurse, dey provide the care, you also get for look at this woman a rights. We always dey say woman e get im rights wey na autonomy. E get rights wey you dey take care of am, but tell you say me the care wey you dey give me I not satisfied with am, I no want, I want for go. Or maybe the mercy wey you want for give me I no want am. But you get the responsibility also for using know-how respectfully if you want for persuade that woman for talk to her, not to like for shout at her or you drive am because you don't say they go, looking at the condition where e gets. So looking at respect to maternal care, confidentiality. For example, we get the teenagers the way they come na the clinic where some man don't get belle, not even know wetin they do. Come meet you, they know say I don't get belle. And because you see e no reach for get that belle, you go begin shout spanner, you go begin talk about am around, maybe you come in nurse there, everybody for know say this pikin don't get belle. If you able forget the way you go manage that pikin situation as a midwife, make sure say wetin you and that pikin dey talk, let be confidentiality, let be secret between you and I&II. You no get rights for expose wetin not tell you for talk about am. And also where we dey abuse woman them, when dem dey in labor also, sometimes we dey beat them, sometimes wetin we dey do also, we dey hala upon them, we dey tell them what they will not find. If you're looking at the respect for maternal care, not a good practice for a midwife. That woman don't come, they get depression. Most of the time they get stress. When they come, now you right for take care of them, give them the best care, counsel them, and also talk to them so that he go able to get the care where he need. At the end of the day, that woman go able to born, he go be safe in and in pikin. So I just want us for me them be everywhere as an example. Make sure say where you dey work, you able, because when they say midwife, you dey within women. So for that reason, if they provide a care, make sure say you respect them. Everything where they need. For example, if they provide a procedure, make sure say you able do confidentiality. What I mean by that day, for keep them privacy, also screen the bed where they get provide that care where they provide for the patient. Where the patient tell you something, make sure say he left to you into as long as you don't want. Even if you want to tell the man, let give you the rights for do one. Also, where that patient can born, no shout spanner, not a good practice. Yeah, I think now that.
Where the nurse come, where the patient come to you, the nurse, not shout spanner, because that's not a good practice. So shout out to all the midwives, to all the nurses them with a good practice and the good work, and where they maintain respectful maternal care. And you where they out there, where don't they do that, continue for do that one day. Whether the woman disabled or whether the woman a dirty way come or in occur with money, not detain and say you not go because of ABC, they will not go attend to you. Talk to them and an opportunity for let you educate them because of the religious background, because of in culture, because of values, in beliefs, all of them things there. So get a key role for play. So what are your expectation, Cinderella, from all the participants them we don't take part in this? How you see them body language or them facial expression by how they go replicate wetin they don't learn from una this training for go with them and cascade them. Because many times complaining they say where some kid don't can training, where they go they not the cascade, or if they go for cascade, others go tell them say no now una be go it's the money, not so we they can give paper. So how you see them from there? You see that willingness or that eagerness in them for me them go for cascade this willingly, and it's even whatever challenge they go meet up like some of them colleagues that we go and behave this kind of way. You see that willingness there in them?
Well, as because for we the training what they do, also they do mentorship. How the midwife they are able to handle situation in terms of work time. So I'm sure because so they train there, we see panel then so gladly, and the way we see them they learn, and everybody even pass the exams and they're all gladly. And I'm sure them promise we say where they go able to go practice what we don't teach them. Then they go teach their company as well. So they all don't sign say them go do them, and we not go just left there where they go. We self get for go they go na the facilities them. and make sure say we dey do a small follow-up and mentorship and see how dem way before implement them, see the way they don learn these 5 days wey dem carry.
Of course, mentorship and follow-up very, very key in denting the hustle. And fortunately, I see some man nurse them or man midwives them apart from the training. But I think I see them at the pediatric wing. I not look see them at the maternity side for the course. Possibly now outside then they work then come for represent. So this message you go want send out more where you they look at respectful maternal care. We are in the woman then go someday in hospitals, and at the end of the day they're not going to meet woman midwife or attend to them, but then go meet a male where go attend to them. How we look like, especially considering some cultures, some background and all, for send out this message to them, say nowadays in the different schools of midwifery we get man them where they go for do this kind course, and themselves still they in that verge for maintain this respectful maternal care, so that when they see them no say no man not for attend to me, even though if they say that they need for respect them values or they respect waiting na their options.
I think number one, the reason why we send most of the man they na the resuscitation area, not because we want to send them there, now because of just like what you say, the area of practice where then they work in our ward, now make them there. And the last time we will be do training, we get some man they also in I&II we be there within the woman they are where they train. Because if you look at the world now, don't advance. We know say now waiting people that we don't believe before, where you can hospital, you just the hope say now just woman I for deliver you, and based on waiting they don't believe and waiting they don't practice before. So now one for just for encourage and say the man they say self get them you, because once for the care for let it be equal. Just like what they say, where they can go to hospital, where they give them the best care where they need. And man themselves capable for provide that care. Not only woman capable for provider. So man the way don't give care don't. Sometimes I go just say that woman said to my work and a man I want to take care of me. So I just want me to get the belief say not to only woman they provide maternal care. Man themselves capable for provide them, and then they save life then. Make them put tradition and other thing them aside and focus say when they go to hospital, then they go for men and go get them well body, and at the end of the day, the pikin go in life will come out and the mama in life will come out. So tradition we respect and so much, but looking at the area of work where we they work, we they deal with everybody. Man can, you woman where you can, man can take care of you and woman can take care of you. Not a taboo for saying a bad thing, yeah, in the medical area. Because we will focus only for save the pikin life and also the mama in life. But you, the midwife, if the woman say no, I don't want for let this man take care of me. I want woman for let. I don't want let this man take care of me. Now woman me wants for let he take care of me. You go try for persuade and tell her, but if you still say that the woman wants, you get the rights for allow let woman take care of her. Because now waiting in wants, we always they give the waiting they want. But we said they try for counsel and talk to them, and then give back again the opportunity to demand them, so that they will be able to provide quality care where they need.
So thank you very much, Cinderella, for letting us get you in this session, and I hope say viewers and listeners them after this program here, when I go learn more and when I go yarn more and when I go there in the position for teach those around una, for let them understand and let them know say inside this training one of the key things we stand out also na respectful maternal care. Thank you very much.
Welcome. Before you start,
Fambulev, I get another cute face now, so we go introduce himself, and I go just want me for say in one other key player inside this training. He go tell we name and which particular parts from the course where he can for do Nayaso inside Mabuka.
Fambule, una good morning or good afternoon from any side where you there. Me na Baneda Rami and me na trainer and I&II where we call Essential Newborn Care.
Essential Newborn Care. Key words. This training done day for 5 days, and Baneda done day even before that because then they deal with rising trainers. Bane, how this training turn like? How you see the participants them inside these 5 days? I know say very hectic practical day and Sunday under then the write exam as the case may be right through these 5 days. how you feel you as trainer for able for groom this number of nurses there and midwives them na the northern part of Sierra Leone for let them able support the people them na the underserved communities and even the people of Maboroka town.
Well, before I tell you how I feel and how this training came over, let I give just a short background of this training. We all know say Salone na one country where newborn then they die boku. So, and we get about 29 to 34 newborn them. What we say newborn are 0 to 28 days picking them, where then they die. And about 1,000 of them they die, and then this number I call when I was 29 to 34. So each of them picking where then they born. Each 10 picking where then they born, one day among we go need help. So out of 10 babies, one need help. And waiting at the help they give to them baby there for bring them back to life. Because when they born, the one out of the 10, they able for breathe. They cry, what we call locally, the baby no grief for cry. They able for cry, they able for breathe. So this training they are, it is about how will they bring them pikia back to life. Inside that 1 minute when they born them pikin, you need for dry that pikin day, you need for keep her warm, you need for stimulate the pikin, you need for tilt the head, and you need for put on skin to skin. Or if possible, if this baby not able to cry, you use your bag and mask for ventilator. It will take 1 minute, what we call golden minute. You know, say anything when a gold, nothing will change. So we change them picking there, and I make we say golden minute. And this golden minute, if you're not able to save them picking inside this golden minute, it will be problem tomorrow in future. So there comes in their organization there, we come for can help with people there, for them bring we come for love with skin with colleagues there and other people there from the north. And I tell you, this training go make a difference na the north, especially the different hospitals there where we get representative, because we see the passion, we see the enthusiasm and the participants there for this training. Then be they suffer, they want this training, this organization, they don't come together for love we do this training, and as also experts then come for teach them. We not get anybody now we not qualified for do this training, so the participants then they all overqualified. And we go see a difference. So now just give it 6 months. Inside that 6 months, the number of picking the way they go save, una self go tell me back, una go call me back the second time. Thank you. Una
go call we back the second term for the good result we una forget. The golden minutes now one keyword we Bane say, because every time during the training they go always ask you say hold your breath. If you able hold on for 1 minute, if you the big person able hold on for 1 minute, what about that pikin when away it just born for begin for blow for himself, we mean say you where they walk that side for sabi and if you able for do am so that pikin go blow, so tomorrow you not go end up for be full or you not go end up for they not they talk or get any problem. So Baned on there for these past days with the help of Ili and helping children worldwide. We get the doctors them as they don't say, we go reach out to them different one they come. And it's so good that we get the district health sisters and the matrons them this time around at this training. We'll go get for talk to later. But Bane, waiting at your expectation of them participants here, and also how you feel where the aid per the nurse them inside this district present and they really pay attention for this training.
Well, my expectations now for let the participants then go back now then different facilities there, cascade this training, so then come in there. We're not fortunate because we're not going able to train all man at the same time, but we give them enough knowledge for let them go pass their knowledge here. So then come in there and already then get equipment there, then get mannequins there where then they use for both skin there, where then people here they don't provide for there now the different facilities there. So then so lucky because other people then they na salon we want them skin we not get them, but this training fortunate for Canada North at this particular time we don't go do at the south when a bow we don do am kenema, and this is the third one. And one thing wey amaze me for this training, this morning na one recommendation wey I make, that the district health sister 1, the district health sister 2, and the matron of the hospital, dem so eager, dem curious for learn that. From day one, imagine the kind plenty work wey dey na the aid, but they're able for sit down for digest wetin dem don teach them from day 1 to day 5. I say kudos to them. They make her feel so proud. I hold them high esteem. So now that's we want for let them go do. And if we say supervision, the matron and the DHS then go able for pass round for watch if na the correct thing then they do, because we trust wetin we don't teach them.
We trust waiting, they don't teach them. And you were there out there, remember say the golden minute is key, and baby were born from 0 to 28 days, now the target for this training. For say, just as the midwives and they say, no belly woman no for die, same way so then they say, no pikin, no for die. If for survive, if for live, if for dey with him mama, if for dey with him family. So Bane, you go say you tata message and you goodwill for this training and the participants and the one who join you for can do this training, and as the case may be, even call on other partners them for me they able for continue for give them support.
Me tata message to me people of Sierra Leone. Una no born na us. Us CBAs and other people there, they're not to train and qualified practitioner there for let they able for deliver una. Yes, then they part of we, and we like that, but then let them can join we at the hospital for let we train them, we impact more knowledge in them, so that when you the belly woman go na hospital, we all go join am for let you save and you baby back safe. As that go bring joy to we all, because when you don't get person from day 1 to 9 months and you see he born, he pikin back there alive, now the joy of the nurse and now the joy of the trainers there. That means we no can do, we can impact knowledge there, we can do good things to be people there. And the nurses them back, we teach one thing about respectful care. Make sure say every belly woman and newborn wey dey na your facility, every belly woman wey can born, you respect them, and also respect in caretaker wey carry them. As that's not been part of it training, where me want for let every nurse na this country practice respectful care, irrespective of you get money, you poor, you rich, whatever, but each belly woman forget the respect we need. Family, now this last word I get to una. Tata.
Tata, and thank you very much, Bane. Good afternoon again. This is now the second part of the program. As I say, we're inside Magboka town, specifically Magboka Government Hospital. And with me now, I get the District Health Sister 1. We're going to introduce himself and tell we how we feel about this training and how this training will really help him when he go do supervision, and how he go send message to incoming district health sisters them when subsequent trainings there like this go na them facilities them. Over to you.
Good afternoon again. My name is Sister Mabel Farmer, the district health sister 1 at Onkolili districts. This training is very, very important. I learned a lot from this training. This training don't make I go able for prevent bleeding, what we call PPH, from woman them, way for prevent them for die. So this training don't make, I don't learn all that. I don't able to map and diagnose say this na subsequent case for PPH, this na case for bleeding. So this training don't teach me a lot where it not go left to me alone. I go send them, I go able for go. Now me different PHUs there now. So me staff them. Because Tonkolili will get about 112 PHU. I will go through all that side and tell them how for prevent, how for identify PPH, bleeding and prevent them. So my colleague DHSs, more not they left out so by this training. We learn a lot. We really learn a lot because we get to skill stations them where after every presentation we dey go there. We go see really how we go able for prevent bleeding na Sierra Leone. We all know say bleeding na the highest wey account for maternal deaths not so do ya. Anytime that people here they come, make we join them. So we go learn a lot where we serve, it go yield fruits. Because if we don't learn, we go able for manage we bleeding cases. We not go allow them to go into a worsening situation. We go able for prevent them, we go make woman they not go die. So that self go make we indices of Sierra Leone with maternal mortality, it go reduce na Sierra Leone.
The maternal mortality go reduce na Sierra Leone. So DHS, wetin go be your message to the participants them na this training, especially wey don say una get 200 and more PHUs them, and not to them all be represented na this training, but una supervision una dey go round na an opportunity for una able for help them, una dey get una in charges meeting and all others them. So which message you go and send to them participants here when they go for cascade the training? If they want to make laziness, let them see the importance for cascade. And same way, so the one then they go me, so they ready for cascade the training. Let them not make that left body say, no, now when I go the training, now when I don't eat the money, na paper no more, when I carry it, when I out boku talk. Whose message you go and give to them? Especially the one we emphasize again on respectful maternal care.
Yeah, to my colleagues then, we all can learn a lot from this training. A better will come. We don't know the know-how really for take care of patients them, for take care of a woman them, for take care of even anyone when a patient wey they deal with, because this training don't learn with a lot. So do ya where we go, make we not sit down, make we tell we company them. Not so everybody go able come na ya, but we feel we come, make we go with the message. We'll go teach we company them. What we pull na this training, more how for prevent PPH, how for prevent bleeding, how for take care of your woman. Of belle woman wey don born, woman where they come even during pregnancy, how for take care of her. What we call say respectful maternal care is very important. We don't see say it help a lot. It even relieve the stress of the individual, of the patients where they come. So if we accommodate that patients here well, indeed, it will improve on we health outcome. So do ya, this word all learn. We all they go with action points. Make we not say na money, na material, na this, na that. With knowledge, make we not left am to ourselves. Make we go pass that knowledge and implement wetin we don't pull na ya. Do ya? Now that's my message to them.
Thank you very much, DHS. Famble, this is a continuity of the interview. We talk about respectful maternal care, and we also don't pay attention to male involvement. Unfortunately, we get with colleagues them when I man them, and we get one where they even part of the training, and as trainer we don't can teach the participants them, and especially na the baby side, because this training be there to the baby their own side and to the belle woman there or the woman their own side. So introduce yourself and waiting really na be your role na this training, and how you see the training and how the participants then perform, and waiting are your expectation for them for go with, and all waiting na be the best way you feel say na thing wey really become surprisingly to the participant the way they really glad for way they learn am.
Okay. Famble, good afternoon. Me na Suma Amara, clinician, actually also the pediatric lead na me center when I Sierra Tropical. For be part of this training actually every year na a booster for me, and also because I get the passion for save lives, and basically maybe don't do all about for help picking them for make them survive in all my facilities where I don't they serve. And the time I've been there MSF, I always done the dinner the pediatric side, and also BGH also when I both government also the same, and also the Sierra Tropical. Yanda now are they almost all over, because I did the maternity side and also the pediatric side, then we did the OPD side, and I like general. So for come be part of this training, it really now like because we need for really be involved in we capacity buildings all about with different facilities. That na one. So I really happy where we participants them they really turn up and that they expect a very good positive impact in the different facilities and where they get for go. That na one. And as a trainer, I know what this mean. And the good thing is I'm Australian born and raised, and I know where you did dongsal. What I mean, you there with the patient safe, then you also there a little bit up there like a lead. You don't serve dong already as a nurse or maybe as a clinician. Done, you come now for can teach. So already whatever person say and whatever old practice person talk about, you know about it. So that's the you find room for able for explain, for make them understand, find and improve. So I really like that part. And to the participants them, they really make up feel proud. Honestly, the ENC side now being a kudos to the participants then. And I feel very good. Thank you.
So the ENC be they all about waiting.
The ENC been there all about the Pekin side, but basically where we dey now we facilities them, we always need to think about two things. During the training where I do for we participants them, now that's not only one patient you get. This one, the ENC been there about two different topics, two different subjects or module. One, now that the ENC one, the ENC in general now like a big topic, big subject, but we separate them into two. The ENC one, in they talk about the immediate care them what we need for do for we picking them, and during the time where they go down born them, for help them how for breathe. For initiate you first breath for the picking, because normally we picking them can they where they can born, not to all can blow immediately where them born them. Some they can need support, some they can need that oxygen, not to for knock them. So that's now the ENC one in your aspect. Then the ENC two, in they talk about the continuous care where we supposed for they do, we assess and we do with continuous care. And that's now the part where I really like. Because many times we don't get picking where nurse they don't deliver or we don't take care of. Then later you get to the mama gonna host. Then after 2 or 3 days or maybe in a week, when you ask the combo, hey, how the picking? They say, my sister, my brother, that picking not survive, not left. We all don't get the stories them, or we don't hear bottom. So now we not only need for the help the picking them for blow, we also need for teach how for do continuous care for them picking them so that themselves will survive. We all have been picking them. So before. So now, we supposed for the also think about them and see how we can improve the health system.
So which final message you go want send, especially to community leaders them, as you just they say just now the continuity of care where they say get a role for playing a mosque, na church, for talk to combrade or belle woman there, or even demand them how for support the woman there, or even the granny them. Then same way so the belle woman there we don't think and say no important for them for kind of hospital where they born a house and at the end of the way problem can before then they run car with the picking in a hospital water can don't pass flower. Which message you go send for the community members them and even the one that we go get opportunity for view and listen this message where you they send, and especially in the underserved community where you get for go miles before you reach PHE or miles before you reach hospital.
So first of all, I want to commend we community leaders them, because honestly this message where I want to say na message where already them be done they tell them or probably them be done they agree before. Now that not keep picking where don't become very sick now you home. Say you see say now you don't they blow one or you need to breathe again and you run care and go to hospital. And the good thing about it now, a lot of improvement there on that part. So I want to encourage we all picking where I want to start with the picking them first. Picking where we see say this now hospital need for take care of this picking. Hospital need for intervene on in treatment. No, we always they ensure say we send them early as possible. Yeah. Not wait until water pass Gary, the way we can say. Then you take the picking now, you want to make the doctor then go certify say the picking don't die. No. That's not one. For the maternity side, we can't really not get a very good name in terms of this maternal mortality. And honestly, this is something we're not proud of. And honestly, I believe that we all not proud of them. Because how on earth, I want to say a very good, I want to talk something, but this now for make we all sabi. Most of them, then mama them we can passed off during labor or whatever, most of them, we self now with communities can really do bad, because some of these them now people and where we know say they don't do operation parent one, or maybe this woman that in first speaking where been born, it been really struggle. Then why you also want for make in deliver na us? So that host delivery day, Nana make us say I really want to commend we elders them. Honestly, we improvement on the day. The hard for make you see now somebody left na host and born. That's a very good news. No, we avoid that they totally. No, always they send we cobra them. I mean, we bella woman them as early as possible. Whatever it takes. Even if you get you health practitioner in your area, no encourage them for make you do delivery na host. Most of the time we get signs the way woman want for going to labor. So as early as possible, we send them, because like some of them picking what we talked about under the E&C one part, and picking the way they go down born, don't know they cry. And picking when they cry, we all done the heavy button before. Picking when they cry, meaning you know the blow. Yeah? Like you said, them born die picking. Most of the time, we don't the heavy say, okay, this one, them born I not be the cry, pass way nurse then help them, pass way doctor then help them. If you keep this woman na house for 2-3 days, assuming you keep her na house for 2-3 days, in Bella still the heart, not born yet, what do you think? Many a time the pikin can dey in distress. The pikin want for come out, but when you carry am go to hospital, doctor then go able know waiting for do, so that they go pull the pikin and the pikin say go survive. But if you keep the pikin at house, what do we expect? Now that sometimes the pikin even can die na the belly na house. By the time we then go now, then doctor just tell them this pikin not there again. So we just they try for manage the cobra and the fetus we not they alive anymore. Till they all the cobra stable, then we think about discharge. So what's not the message when we want for get we community members them, especially the leaders them. No, we be vigilant. Anytime you see Bella woman where this one, first of all, they attend ANC, meaning they go clinic. All the time, no, we encourage them for go clinic. Ask, confirm whether in the go clinic, because the clinic in the first part we go able to detect whether this woman get for able born for himself, or whether the woman okay, whether in blood level okay, or whether the pikin self okay na in belly, or whether in go able born, like I say. So the ANC part, no, we always they encourage them. The hospital, now we hospital them. Then build them for we all. So now we encourage this hospital, now we get them as a nation, now we get the hospitals them all. So now we ensure say we really deal with all the health, because every community gets a health center. That's a very good news for the country. So you not go say my own center outside there or my own community where they will not get health center. No. Always try for work towards the improvement of we woman them, we mama them, we sister them. Yeah, so that's not the message we get for you all.
Thank you very much, Suma, for taking to essential newborn care, where they call E&C 1 and 2 for this year's session, na Magboroka Government Hospital. Thank you very much.
Thank you.
Matron na Magboroka Government Hospital. Matron, you go tell viewers and listeners how do, and you go tell your name and all waiting this training day about how you don't learn and how it will create impacts na your hospital and the member facilities that we there around.
Good afternoon, Fambulde. Me na Matron Fatima Takagbo, wo dey na the Magboroka Government Hospital. Luckily, we get a very fruitful training. We start from Monday and end today on maternal and child health. And as we know how we mama them, they die, and even the pikin them, would then say worldwide, we dey among the countries then where the maternal and child mortality rate is so high. So governments they go all out, partners they go all out, so that they see say we mama and we pikin they no go die this kind way. So this very important training, where people them from America then come together, pay tickets for themselves, put together for ensure say themselves take part for camp and help with the way forward for try for reduce the way wo mama dem and wo pikin dem dey die. And one very important way na for ensure say dem build with capacities dem. We sabi that the well body people then, the nurses there especially so, you know say na wuboku pan this kind work. So one way na for make sure say we sense and how for do things them for see say mama dem no die, dem can't born, dem no bleed, dem can't born after birth no fasting pan dem. This training na in the people here come for show we. Even though we don't get more trainings, but then come back and come with team them who will go able for work with, so that bleeding no go kill again with mama them. After that, where they left, then show more ways how for do so that they go able for pull this after birth will not go cause death for mama, and we pikin them back go able grow and get Bobby healthily.
Thank you very much, Matron. Famble them, are they with one of the male participants in this training? I don't know if una go call her midwife or if una go call her mid-husband, but they part of this training.
Good afternoon, Famble. Mina Andrew Kamara at the Namasanga Hospital. I'm fortunate to be one of the participants for this training now. So I'm blessed because I learned putting them work up on this training. Because as people know, so many call it midwife, so they say mid-husband. Let's say we say we all Nigerians are winning a midwife. Yes, but they call mid-husband. So I'm glad because people in the share way, women, they take them work there. Especially we saw the work at the villages, but we fortunately the Masanga, but who they sensitize people there, they go outreach, they explain to them. Most of them they don't used to win now, demand them, who can deliver them, they do other things then, so can feel fine. They know they shame now, and they come out plain to me. So and we don't can this training, we don't can take 5 days intensive training, and we really glad because I can learn a lot. And I hope say what the go so now, but putting in the go na new thing then what I don't learn. So when I be visa sabi, but today I don't can no say yes, but putting in the what lack, and I don't can improve my knowledge more. And where they go now, me say we go pass knowledge to. They are all they not fortunate for car. So I really glad it because the training you find one time they in camp. We tell thank you to the partners there, where they all car will make it possible for this training now. So I tell now all thank you for listening. So
you go send message to your company male nurses them for let them see the needs, say midwifery and other what they can take as their specialty, because some of them they do arena or BSc. Most people want go public health as the case may be. But from your message and you were there in your immaculate white now and how you done the work and how you don't even deliver woman them. Now this part, how you go send message to the other man them within the other districts them for let them all their work to one, for let them be passionate and believe say more woman them go even face them than if how then they face the woman midwives them.
And some people in the share for do this kind of, they say, hey, na man, what's the companies now this place here? So you see, but me they tell us say it's very important, and right now people they encourage you pass the woman itself, who compete woman. Yes, because they say we compete woman because we are part of the woman system. So you see, so now for people like we start the work now, I don't deliver past 100 and something. This short time I go Masanga. Now 2 years now. I don't deliver past 100. So then who I don't go there is some beginning who I don't deliver. So they don't work. So anytime they see me now, this now parties will be delivered. This now demand this. This man is sabi. So you see, so me encourage people demand them more. Let them come. But people go, I don't go do public health. I don't go do public health. These are talking all day. What did they go do public health? First time they go know how the dirty box day, how other things and they now come join now this what all day because the man they will not go up on this field. Especially na salon na will not go now few because then they shame for can't join they say because this now woman oh could I tell you that day Also, the Panis feel no more. Be safe, you don't see na the car talk to you, so the experience on the end, so they add more experience. And right now, good people now, we young staff and say, well, nurses and this are. They want the Masanga hospital. Then they tell say they need to go to the company. Then they pray and say, Mr. Andrew, there, the time where they born, let you did it. Then you call me if I know they self na not to me ship self. Then you call me for that present because they say as I be encourage them, as I be talk to them because certain of nurse they all know who na nurses. So they will say, hey, na me bele, I been did it. So all that short of story then we now be na komra we self na man there we know how the Bible will work. So no say na painful something. So you get for encouragement and then encourage you they give them and make them glad for come to you.
Thank you very much.
You're welcome.
I'm so Fambolade with another cute nurse where done dey na this training, and of course they come on one of a faith-based facility under the Christian Health Association wey na Chasu. You go introduce yourself, wetin na your name, whose facility you come out.
Me na nurse Awana Tukanu, I come out from New Life Clinic Yongo, Lunge.
So you can tell Fambul them how this training very important to you. Apart from all the other trainings where you don't go, how this training don't add to your knowledge where you go care go now you clinic where you come out to even pass on the information so you compete the way not able can because of the work.
Well, I want to thank God for this greatest opportunity. I want to thank God for Chasus because now they make it possible for let I can witness this training. I believe say this training it helped me a lot for make I go waiting, think I will improve my skills and make I will go waiting, go try for teach me company them. And we go help for reduce maternal mortality rates in the country.
So now this na the north we don't get training na the south, we don't get last year na the east and now na the north. And we get for 3 facilities them where they under Chasul. But here we able get we member facilities then at the north for let the able come, but all the members not able come because IFIB everyday woman and they born, everyday picking and they go hospital then they sick, but you don't get opportunity for can learn this one. So which message you go send out so you compete them for make them go pay attention as you they go cascade the training for let them not put that resistance for say now you go the training sinap they me not they come for the training and all how you go cajole them for let you pass this important information where they don't you let you know keep unto yourself so that you know say when you get day off you go really relax not to day off where them go always they can to you because now you sabi but of course where you go you they pass the training to them.
Well, I will go talk to my company them and encourage them. One, we for no say that that's what we don't train for let we save lives. So I therefore go encourage them that let we all join them together and we go do this work here and we go do this work for save women their life now this country and now the world as a whole that woman enough for diaper and bone.
Thank you very much.
You're welcome.
Yes, Famble them are there with another gentleman where also they part of this training. As you see, you know say already they on the way now for go because duty demands it. They don't leave them facilities them for days for can train and they are well equipped now. You go share your experience, tell we name whose facility where he come out. And I know say that one of the faith-based he come out under Chasul. He go talk the facility and waiting na experience where he don't can ayaso.
Yes, me na Sylvester Ngauja, a CHO from UMC Doris Atin, supported by Chasul. We there for the past 5 days for learn on essential newborn care. Of course, the training be so awesome and now hands on the deck training, practicals, theory, exercise and all, and we learn a lot. We don't ensure say today me why they come here so today. I don't make sure say I don't acquire a skill where I will able for use na my facility that no picking no go die there for resuscitation problem.
No picking, no go die there for resuscitation problem.
Because the skills them all I don't able for grab them and I don't know the technique and I go make sure say I go share them back with me other member facility.
So send message to you company them out here. We not get the opportunity for come, but you as a community health officer, now that facility they don't come, you get a whole lot during una meetings them or during una in-service training and how you go schedule for let you go pass on this 5 days very hectic training for let them they part so that when next time you can train it like this, you know say then where they on ground go do equally as if you did it.
Of course, we don't get the handout then and I even get the soft copy of the material. When I go, we go schedule a time when we get a leisure period for make we go start again, make I take them through on all waiting we don't learn and maybe during the process of that particular training, we go fortunately forget a case like that and we go make sure say we will apply the skill and save that particular lady.
So you go want for send message to your communities out there where go there na the surroundings, how them go able identify some of them case them, and how them go want for Kana hospital, because when they can go meet this master sabi person we go able for help them picking there, so even them belle woman there, so for let nobody no go die.
Yeah, some of the signs them at community level where they need for they identify anytime picking get fever, especially a newborn. Picking where they don't born na facility, na a hospital, when it don't go na host, anytime where mama she say, this pikin are not the breastfeed. It make sure say they know say this na one is science them. If she say that pikin they, then at all the pikin they cry often. Irrespective of whether the pikin it don't dress am, it don't pull the diapers pad panam, all thing, but see the pikin they cry often, it not the breastfeed, or if they see say one of the limbs them they convulse or they shake unusually when not to the usual way that the way for happen. When it taken at the facility, we make sure say and we give them the needful medication, treatment and skill way will help them.
Okay, thank you very much.
Yeah.
I'm Famble there with me. I get very key personnel from the Directorate of Nursing and Midwifery Services. He go introduce himself and tell we small thing, 1 minute no more, but waiting he presents na this session what we did today for the nurse them, waiting he do and how important for the nurse there your well body one.
Famble there, na afternoon. I'm the Director of Nursing and Midwifery Services. I do presentation on then drugs there and other substances abuse that we use in this country. You know, the chief nurse officer and medical officer and Minister of Health always they talk say anytime we go, we need for help, government will do to it. Because drugs in this country don't be some material and the problem from today. And so anytime we go opportunity there for talk to the nurses there, you know, other people they always talk about this drugs abuse. The thing that the bad effects on the people that they take the drugs and also on the society. And that's our big presentation on the meeting.
So which advice you go want send to the midwives, the nurse them and the well body workman the way even though they part of this training by how whether why we don't candidate whether they go cascade for let them pay attention and any opportunity or DHSs they get for let them make use of them just as the matron and the DHS them be there at this training.
One thing we try for tell them, well, the first thing first, whether they choose them for Kenya, they represent facilities. When you go, whatever you don't learn, you get for share with the one that we left and the facility under. Because they say need for know what you don't do. Anytime you can in training, you must learn new things. So then new things the way they learn, they need for good share with their police and back in their facilities. In relation to the drugs abuse or substance abuse in this country, I just beg them say, well, they not for dread the patient the way they can have facility to them. They need to encourage them, talk to them, engage them, so that will help them. They know what's not the problem, then they stop for taking the drug. But if you can't use them, they go far. And when you go nobody for talk to them, fine, we'll continue for do the bad thing. And when it was, the hospital they can and then they end to week for treating them. They will not go out for prevent it's cheaper and easy than for treat. So as I talk to them, all other nurses and midwives and this for other health workers, we need for help, we need for talk, what the government does we do for make sure say this drug business will stop on our country.
That's now the voice of Mr. Senesi Magao. Thank you very much.
Thank you.
With me now, so now we don't do course pan picking business where they call neonatal nurse. And he attached na the Maburoka Government Hospital, specifically the special care baby unit. And then I also for tell we about this training where he come and how this training help him and I make he recall the time where he spend again at class where they go through course like this. And now we feel also for day in the midst of other colleagues them when I midwives them and him when I picking us and for day with midwives them how we be turn leg and waiting at the experience where he go share and how this do help him more and more in work.
Well, me na Aisha Max Bangua. I want to say this 5 days training work I attend, I'm so happy, I so feel good because, like I almost say, this training we can get to, not training we don't go through. Yes, and I get the knowledge. Although yes, we can at first because I not be understand the training because of Mikeda, I can't talk some people, I ran the midwife anything. So I can say, I'm not stand cause me they can, but like the first day. We don't introduce the thing to her because so confident because like now cause where I be don't do. And I'm so glad in whatever session where they come out, I can always flow, I can always answer questions there, and I'm happy because I don't pass through this course. And although yes, the first way I go to participate in business, I be find it difficult. But like the team will be meet up, with on where I go past this course, they give you the confidence, they give you the confidence so that we go get that confidence there for see picking them, effort it picking them. So like as first 3 months pass, second month you can't get the confidence because they teach me how to take care of picking, so like I get that confidence in. So because when I make this 5 days, I'm not finding it difficult because I don't go to one. And let me say, I don't say any fresh thing by this because like I don't go to one, I just back up no more because no difference, no the way I be don't do by unit and not see difference, no the day towards this, they're the same. So I feel so proud, I feel so happy. Although as well the KDRT they be confuse me, but like as time go, as they go take down to the last day exams coming. Oh, I so feel in terms of practical, even the with who I be talk. If I don't answer, if you ask me questions, how many deliveries have you done do? How many experience have you done get public in business? Although I tell us yes, but deliveries are not getting any experience. But like, I be don't get small one day through this business way I do. So I'm happy for that one day. And the exams come, you sit the exams, I score because I'm 25 questions, so I get 25 over 25 in essential newborn care. So I'm so proud of that. And after the end of the competition, I congratulate me both the theory and the practical. So I just want for motivate me completely. Whatever I say you do, just put seriousness, put all your mind there. Don't forget about money, business, anything. Although yes, okay, the other way around, you get for the boss. As long as you don't get in mind, say, I want for this thing, I want to learn for this thing. Make sure say put all your mind into us and everything. Me no say that it help me by this. Because some of them don't know one in the first wait to say. These 5 days where they can meet up. Although some man they actually be don't go this. Actually the way say now yes I say I don't go. I'm proud of my and I trust all the one they were passed through free talk for land discourse. So I so happy.
So you can use this opportunity now for send message out so you company neonatal nurse them. And the one themselves where right now they do BSc or they do other course, whenever things say neonatal nurse na a specialty where you as nurse can take part pan, not only for like work na the special care baby unit, but even where they inside keke, you dey on top bike, you dey pass na your community, you can see picking identify and say this picking get problem, and you go able for advise the mama and all of them one and they. So I will let you send message for encourage them, and even the neonatal nurses they out there let them continue for do them best, and the one that where them go soon to be recruited for let them go for the next cohort of this training.
Well, me concerning the neonatal course, I just want to encourage my colleagues the way that they out there. Now find course. Because me, I did part of this 5 days training because of this neonatal course. Because like wait till I be don't go learn, I can't do na the SCBU, then choose me because I be don't do the neonatal course and what we come and waiting they see what they do na the word. Then I may go this course I can straight our SCBU first na they think of. So like I just want to encourage me company out there, not just say no more. I done in a picking business and they waiting say for me waiting me no more nothing. As long as you don't say you not a nurse, they expect say for sabi everything. So and picking business now the number one priority now we come to you. So if you dey out there safe, you go see society cases then they you go for interview. Speak here, the way they make and then a social condition on a social treatment speak here, you will get the confidence. So I advise everyone neonatal course now very fine course. And I advise you now let everybody go in for neonatal course.
Neonatal na fine course, and they advise everybody we get passion for neonatal business or you like picking business. No say specialty day for that day where you go in for do that one day. So Aisha, assist upon this training, you district health sisters then come, and same also you matrons themselves come where now a very good signal, because many a time the mentors them don't they go around on supervision where una be don't do this post basic certificate neonatal nursing course, and then they go for mentorship, and when they can go at times they can attend una review meetings them where the matrons thinking they some hospitals sometimes they can very difficult for penetrate, but others it can easy. And because then they see how una done the work, and in time in memorial how it be done there now greater improvement on the. So how it turn like how you feel where you met on the part of this training where go really be a support to you now the government hospital or even the hospital self for you attach.
Well, me are glad wey the matron dey part of this course, because let me say in for certain things dem dey na the world wey we lack of, like wey we put across, no can take
they delay small.
They delay small, yeah, no can intervene quick. But like when they don't come part of this course, they will all witness them and they don't see say this neonatal business not a fake thing. We know they just can't talk out for say or the tutors there, we mentors there where they lecture we just want for can fear for the name they no more for charity self. We are glad whether they pass off because they can see everything what you will come off, we don't come and can't explain good, they don't see an answer or say yes, not to lie will be the lie, or not just they can no more for can make their good name or so. So I'm happy with the pass over. So if anything said, any lack of material equipment in terms of SCBU, if self will put our course, we will intervene quick. So I'm happy with the part of them.
We happy with the part of them so that then self know what it mean. Where you say we want CPAP or we want oxygen machine, they really know what it mean because of this 5 days hectic training where themselves don't come they part of. So we hope say other matrons them and other DHSs go do the same for CAM. So say tata to fambul them and to your colleagues them out there where on then at different hospitals them at the SCBUs for this opportunity we get for the this training will serve as refresher for you and not new but it serve as refresher for you.
Well, I want for say tata to you all, and also I want for give a special thanks. Thanks to the neonatal team in Freetown, especially Dr. Adetola, Sister Gifty, Sister Meze, Sister Amara, Sister Bridget, Sister Aminata Lahai. I so feel happy, I be so proud, I be get confidence. Anything they talk about practical business by these 5 days, I get confidence because I know the people that were passed through. So I not block any there. I not sit reference some of them sit all of me and not sit. I tell God thank you. So like I just want for tell you say neonatal are the best. And whether they teach you don't for put all your mind. Me na post is it and where I be I not be get confident. But like through neonatal cause the team where I go mix, they give me confidence because down to you lowest a language where you for understand, they make sure say you understand. So now me this 5 days thing I not get anything where I go. So I just want for tell you now thank you and whatever possible they part this cause or if you get anything for go do me at the advice na say neonatal cause na go in for them. That a great cause.
Thank you very much.